Hello, in this video, we will be discussing the importance of empathy in OET speaking. Empathy is the ability to understand your patient's perspective or his or her feelings, and it is used to facilitate a more accurate diagnosis and to improve therapeutic effectiveness of your communication with the patient. It is a vital skill in improving the patient experience, and it will also help you in maximizing your score in the OET speaking test. So these are some of the empathetic phrases which you can use to acknowledge or validate your patient's concern. For example, you could say, "I can sense that must have been very hard for you," or "I can sense that must have been very challenging for you," or "I appreciate that this is very difficult for you." And appreciate here means to understand the situation. You could say, "I appreciate that this is frightening for you," or "I completely understand that it must be very difficult for you," or "I completely understand that it's overwhelming for you." And overwhelming means when somebody is consumed by their emotions, when at times people experience a very strong flow of emotions. "I understand it is challenging for you to cope with this situation," and it is a reasonable reaction. When you say things like this, it validates your patient's concerns. It makes them feel heard. It makes them feel acknowledged. You could also say, "If I were you, I would react in the same way. I can see why you have this concern. I can understand that this is worrying you," or "I can understand that this is a daunting concept for you." Daunting means something that's scary, something that's intimidating. "I'm sorry that your pain is so high. I know how emotionally draining that must be for you," or "I know how emotionally draining this is for you." "Oh, it's a pity to hear that." When somebody explains something bad, like having pain or something bad has happened in their life, you could empathize with them by saying, "Oh, it's a pity to hear that," or "I'm sorry to hear that." "I understand your reluctance, and it's not unusual for people to react in this way." Obviously, this phrase would be used when you're giving advice to your patient. Now, empathy can also be used to elicit information from the patient. And eliciting means to gather information. So we're going to use indirect form of language here. And I'm going to have another video to help you understand the difference between direct and indirect language. "Can you bear to tell me how you have been feeling?" "I'm sorry to hear that. Could you tell me a little bit more about what's bothering you?" "I can appreciate how difficult it is to talk about this. Please go on." "In your own time, could you please tell me?" And then you could proceed with your question. After your patient has answered his or her questions, then you should always thank the patient. "Thank you for telling me about how you have been feeling." Or, "Thank you for answering my question. It helps me in understanding the situation much better." So this was a short video about empathy. I'm going to have more videos coming out soon to help you understand the soft skills that can be used in OET speaking.